We'll discuss about lactose intolerance. What is this lactose intolerance? Normally, we all know that the children consume lot of milk, mother's milk, and the body will also produce lot of the enzymes to digest the mother's milk, and that which is a major food for the infant for the first 6 months. This everybody knows about this universal truth. Now, as we age, we don't depend upon the milk for our nutrition, and we take different kinds of food. So the requirement of the lactase is an enzyme which will digest to the milk. The requirement of this lactase will come down as we age, and by the time we reach 60 and 70 years, the enzymes will be down regulated. That means the gene responsible for the production of the enzyme will not function. Its functioning will come down. This is called down regulation, and because of that, the world people may not be able to tolerate milk and milk products. And because they are not able to tolerate milk products, they will have symptoms like having diarrhea, stomach pain, that means loose stools, stomach pain, stomach fullness, vomiting like sensation, nausea like sensation, and losing a lot of fluids from the body because of loose watery stools. These are the symptoms which are seen. And we don't have that lactase enzyme supplements for many years. Recently we are getting it from the Western countries. The case is that if we can prove that lactase deficiency is there, we can add that supplements. If at all the elderly people who are deficient wants to take some milk, they should take milk with enzyme so that the digestion of the milk can be easy. I think though milk is always said to have higher amount of calcium, the amount of calcium in the ragi, when we make a ragi malt or ragi dosa, is very higher when compared with the milk. And the milk also has lot of trans fat. With the current available ultra heat pasteurized milk, we don't get the exact milk like that. They heat the milk to make it a powder, and then they dissolve in water to get us thing. So personally, what I believe is we should find out so good sources of calcium like moringa leaves and this ragi malt based foods, so that we get a good calcium, and otherwise the milk is not going to benefit us much. And so this is a thing about lactase intolerance. There is the genes is called lactose fluorescein hydroxylase gene, which will be down regulated with age. So my take home message for you is that when you have elderly people in your house who are having diarrhea or who are having abdominal pain after consumption of the milk, try to cut down the milk and see for yourself. And if you want any further help, we are there at Fortis to help you about this condition.